Each year, more than 15 million people worldwide have strokes. Most of those who survive will experience some degree of physical impairment, weakness, or paralysis, making stroke the leading cause of long-term disability. Here to talk about stroke signs and symptoms and the importance of seeking medical help immediately if you think you are having a stroke, we've got Dr. Justin Singer. He's a director of vascular neurosurgery at Corewell Health in Grand Rapids. Dr. Singer, thanks for being with us this morning.
Thank you so much for having me to talk about this important topic.
Absolutely. So crucial. So let's talk about the basics. Describe what is a stroke.
Yeah, the most common form of stroke that we see is one that's called an ischemic stroke. That's the kind of stroke where a blood clot will break off from somewhere in the body and lodge itself in an artery in the brain. When the blood clot does block off an artery in the brain, it deprives the brain of oxygen, and brain cells die when they lack oxygen. Millions of brain cells die every minute that happens. So early diagnosis and treatment are really critical.
Okay, absolutely. So now Butterworth Hospital, that's a certified comprehensive stroke center, and so is Corewell Health's Beaumont Hospital in Royal Oak. Can you explain to us the significance of that? What does that mean?
Yeah, so we and Royal Oak are comprehensive stroke centers, and these centers offer the highest level of stroke care available 24/7, 365 days a year. You know, we go through a rigorous accrediting review, and then we have to perform a certain number of procedures. It really offers the highest level of care available. We are the busiest stroke center in the state of Michigan. Beaumont is also similarly busy at Royal Oak. And together, we really are a robust network of health system hospitals that provide the highest level of stroke care, really exceptional care to the locales that we offer care to.
Yeah, so talk about that care. What kind of care would a patient expect after having a stroke?
Yeah, so for a patient who has a stroke, this is somewhat of a continuum of care that starts with early diagnosis and treatment. We have clot busting medications that we can deliver to help break up a blood clot. For patients who may not be a candidate for that, we offer emergency catheter procedures where we actually stick a catheter inside an artery up into the brain, and we're able to retrieve or pull the blood clot out. Now, in instances where patients have already had a stroke after they've had those treatments, they're admitted to the hospital. They undergo very intensive neurological monitoring. First, we need to evaluate and figure out why they may have had it and implement treatment to prevent them from having another one. And then they also start the rehabilitation process quite early on, where they're evaluated by therapists almost immediately. Now, these things are very important, and having this sort of experience, especially in the setting of an emergency, can be very harrowing for a family. And we try and make it simple. We try and make it easy. Patients get plugged into all the necessary specialists that they may require for their follow-up, and they're plugged into the network that really they need to help minimize their risks of having another one and also enhance their recovery with rehab services.
And we talk about the urgency of a stroke, and if someone needs help, they need to get help as quickly as possible. So what about people who may not live around Grand Rapids, up north, northern Michigan? What should people there be doing?
Yeah, within Corewell Health, over the past few years, we've invested in developing other community hospitals that we partner with in becoming primary stroke centers. So they're kind of the first line of defense in those areas. Zeeland, Big Rapids, Hastings, Greenville, just to name a few, and there are others as well. And they partner with us, and we use virtual platforms, and we have an AI app that we have on our that we can access on our mobile devices, where we can communicate with those hospitals, see patients that are having strokes virtually, and then triage them. Sometimes patients don't need to be transferred down to Grand Rapids for care. Sometimes they do, and we can identify those patients early, get them to us, offer them these emergent treatment options, and then help facilitate them through the process.
Okay, wonderful. And, let's get to it. What are the signs and symptoms of a stroke? When do people need to get help?
Yeah, I think, being aware of someone maybe having a stroke and getting them help early is absolutely the most important thing, because treatment is time critical. If patients wait too long, the brain injury may not be reparable. If they get to us early, we could offer them one of these advanced treatments. So how do you diagnose a stroke? We use an acronym called B FAST. So B stands for balance. Somebody who's having a stroke may be off balance, have a difficult time walking or ambulating. E is for eyes. They might have blurry vision. They may also have abnormal movements of their eyes. F is for face. So someone who's having a stroke may have drooping of one side of their face. A is for arms. So if you ask them to hold both arms up, one arm may subtly drift downwards. This is a subtle sign of weakness. That could be a sign of a stroke. S is for speech. Most people know this one. Someone who's having a stroke may be slurring their words or maybe speaking nonsensically. and T is for time. We've already said it once. We'll say it again and again. Time for stroke is so important.
Absolutely. Yeah, worth repeating over and over again. Dr. Singer, quickly, what are things people can do to maybe prevent having a stroke? Is there something we can do to help prevent this?
The best way to take care of a stroke is not have one in the first place. So we call that primary prevention. Seeing your doctor regularly, healthy lifestyle, lower fats, low salts, make sure your blood pressure is well controlled. If you're a smoker, the best thing you could do is stop smoking. And regular routine visits with your doctor will really help optimize all of these things and reduce your risk factors in the future.
All right, Dr. Singer, thank you so much for your time. We appreciate it as always. You want to learn more, head to spectrumhealth.org. We'll be right back.